All right, welcome. We are back with our next Fellows in Focus here. We have Miheer Pujara. Looking forward to hearing your history, your background, what you enjoy about the university here as a fellow. So let's kick it off there. Tell us about growing up, your family structure, things like that.
Yeah, I grew up in a suburb a little north of Dallas, Plano, Texas. I was born and raised there with my two parents who were both in engineering. My brother, who's 4 years younger than me, also landed in engineering. But the biggest influence medically for me, I think, was my uncle, who is a critical care doc. And we spent a lot of summers in his staying with him and his family in New Jersey. And that kind of put the seed in my mind of going into medicine. And so when I was in my senior year of high school and applying to colleges, we had some family friends who had gone through this combined medical program with between Penn State and Jefferson Medical College. That was a BSMD program. So you apply in high school, and I just kind of did it on a whim. I was anticipating actually swimming at a small school near where I grew up at like 40 minutes from my house. And I got into this program, and so it was just too good of an opportunity to pass up. So I moved to Pennsylvania and went to Penn State, which was a lot of fun, and went to med school in Philly. Um, and then from there, it's been internal medicine, medical training through Hemont.
Got it. So you probably had some interesting dinner table conversations with a lot of science.
Yeah, yeah, definitely. Yeah, my parents both kind of worked at startups, and I don't know. It's always interesting to hear that world, and then how much it contrasts with medical. I guess the field of medicine generally.
Yeah, I think it's interesting. So I have a lot of physicians or pharmacists and other just medical providers in my family, except for my wife and my mom. And so they would always joke that it would be like the nerd discussions over there, and then they would separate because there was such a dichotomy between, even though my wife has her PhD, but it's in food science, and so it's kind of a different thought process
Yeah,
in general.
yeah, definitely.
They're, Given their engineering background, although you said you had your uncle, um,
Mm.
that's a pretty big jump to jump right into that combined program. And there aren't a whole lot of them. There are a couple of them I know. But
Mm.
was there any hesitancy from your parents about sort of jumping into the career path or essentially earlier than most people would?
Yeah, no, I think my dad actually was the one who brought it up because one of his friends from college, both of their kids went through that program. And I think I had volunteered a little bit kind of throughout high school in different medical settings, and I was pretty set on medicine as a field. And when I was looking at colleges, I was looking at, places that have good pre-medical training and have good rates of going to medical school. And the idea was kind of like, well, if you can apply directly in high school and you're a good applicant now, why not take out one step in one application process?
Mm-hmm.
Um, and I guess there's pros and cons to making it shorter. Mine was 6 years, so I had really 2 years of undergrad total. But at the end of the day, I mean, the pros and cons, it made sense to me. I wouldn't change the way I did it, I guess.
Yeah, interesting. Um,
And that's kind of how it is everywhere else in the world in some way.
yeah, totally,
That
totally.
it's all integrated. Yeah.
Yeah. And I think you're right in the sense that you kind of, if you know that's what you want to do. We have a family friend who did that too, kind of in Missouri, and has been
Mhm.
very successful in her medical career and is a brilliant person. So,
Yeah,
you get it's a self-selection bias a little bit, but if you know what
definitely.
you want to do, you're right. You might as well get into it.
Yeah.
So
And
then
and
what made
during
you, oh, go ahead.
no, sorry, I was saying during med school, I was part of the interview process on the other side,
Uh-huh.
interviewing high school students applying in. And it's really interesting to see. I mean, you can tell who is kind of being pushed into it by their parents and who's kind of doing it for their own interest. And I never really considered kind of the other side of things because my parents didn't really push me, but that's a big factor as well, I think, too, in medical training.
Yeah. I mean, I did med school interviews when I was in med school. I did them, but that's a different world. High schoolers are different. They're a different breed,
Yeah,
right?
yeah, yeah.
So,
Very undifferentiated, very
yes,
potent. Yeah.
exactly. So speaking of differentiation, what made you choose Hemonk then?
Well, so it was a long change of events, I guess. I was a scribe in an ER for a couple summers, and I thought I wanted to do emergency medicine for the longest time. And it wasn't until like I finished my ER rotation right before we started the process of applying for away rotations and starting the residency application process that I realized I wanted a little bit more continuity than you would get in emergency room care. Um, and I had a really good experience in internal medicine and working with a chief resident who ultimately went on the HEMONC fellowship, but somebody who kind of influenced my decision to go into internal medicine. And I really thought at that point that I was going to go the route of critical care. It was sort of a bridge between emergency and internal medicine. I had my uncle who was a big influence on me and always kind of in my ear talking about critical care. And so that was a big factor in where I applied to residency and eventually decided to go to the University of Colorado. And I mean, I think I did more critical care time training there than I did like general medical work. It's a big critical care program, which was awesome. And I think I enjoyed that training, but along the way, a seed had been planted. I think if I'm thinking back, probably as early as second year of med school, of like how interesting the field of hematology in particular is. And then my interest in oncology kind of grew during residency. And then seeing what life was like as a critical care physician kind of made me pull back a little bit. And I pulled back so far, I actually briefly thought about going into palliative care with my experiences in the ICU. And I think what I ended up finding was that HEMONC is like a great kind of place in between those two fields. And there's so much that's interesting in the field, just scientifically, but also like the dynamic you have with patients. The way I've heard it described is that it's like slow motion critical care where you have time to talk to the person you're actually taking care of and have kind of meaningful discussions over long periods of time. And I think that's ultimately what drew me to the field the most. At the end of kind of residency, I did end up working as a hospitalist for 2 years in between as I was figuring out my path and waiting for my wife to finish residency as well. So I had some time to kind of make sure that's what I wanted to do. But that eventually, I think, was what drove me to the field.
Yeah, and you make a great point about how there's that connection and emotional connection across both. And I also think about the science, right? There aren't a ton of fields where you really have to know head to toe essentially every body system. And HEMONC and critical care are those two, a bit different in terms of urgency, but and I can certainly attest to the palliative care. I took rotation when I was here as a resident and loved it, and almost got pulled that way as well. But still use a lot of those skills, even if I kind of
definitely
got back on the path I had initially planned on.
Yeah. I feel like that's one place where I'm always learning, and I'm always, when I'm in a family care meeting, trying to pick up whatever the palliative care doc is saying and add it to my toolbox, because it's what we do every day, really. And it's very rare that you see how other people do it. So that's, I feel like, a big, I don't know, a plus of this program. I feel like the palliative care department here is really strong, and everyone is so great and open to learners. It's really great.
Yeah. And now you've taken us on this pathway from Texas to Pennsylvania to Colorado, and now you're here. And I remember interviewing you, and if I recall correctly, don't really have any ties to Minnesota. So what brought you here? What were the values that our program brought for you?
I think I, having done medical training on the East Coast, very clearly knew that I didn't want to stay on the East Coast. I think the hospital culture there is just not what fits like my personality or my values, really. Not to say anything bad about the East Coast generally, it's a big generalization to make, but I think the interactions between services just in the Midwest generally, it's like everyone's on the same team. It feels like there's always going to be strife generally, but it feels like everybody's just kind of happy to be working with each other, which is not something that I always experienced. I was a hospice on the East Coast as well, in between residency and fellowship. And it's just, I mean, it makes a world of a difference in your overall, I think, well-being and how you approach patient care when everybody's kind of on the same team. So that's sort of why we were looking at the Midwest generally. And then I think my wife's a radiation oncologist, so she graduated basically like I matched in December and she graduated that following July. And so we were looking at places where we could both find medical jobs, which is not easy in the rad-onc field right now. And so we were looking at places where there was like good, well-established medical systems where we could be able to afford buying a house. And starting a family and kind of hopefully set down roots, because both of us have been moving every couple of years with medical training. We've been a little bit nomadic, so
I know how that feels.
Minnesota just was kind of the perfect combination of all those things, and we love it here, really.
Yeah, I feel like in if I'm trying to catalog where do I know a friend, or it's like, where was I? Was I, for me it was in Tennessee, was I in Minnesota, was I in Cincinnati? Yeah, you sort
Yeah,
of live in these, or I was in Indiana for my college. Like you live in these like 4 month, 3 to 4 month, or 3 to 4 year
yeah,
increments.
yeah, yeah. And I feel like it's also funny with medical training how much people kind of come together at one site and then eventually kind of move on, and everyone's kind of spread out all over the country now, but more places to visit, I guess.
Yeah, but then your group, in some ways, your network gets a little, your group gets a little smaller, but your network gets larger because you have a
Yeah,
smaller group of people that are still interested in the same thing, and so
yeah,
um, it is nice, and it's obviously much easier to get connect with people.
definitely.
Um, I remember when you were interviewing, you had some interesting research. You're talking about some interesting research topics, a little bit outside um, of the norm, which I was really excited to hear about. But to be honest, I don't know where this has taken you, kind of as you think about research. So tell us about your research pursuits.
Yeah, yeah. So I haven't done a lot of traditional research. I have kind of dabbled, I'll say, in kind of clinical research, but my interest has always been in trying to make the system of healthcare, whether it's technology or the way we kind of have our practice, work better for us as clinicians, make things easier. Basically, I get frustrated with things and I want to make them better for myself, and in doing so, make it better for other people. So before coming to fellowship, some of that was like working at a VA in Colorado and trying to put together a wiki site for how to get things done to where you didn't have to figure things out every time some new intern started at the VA. Or things like in as a hospitalist, I started to kind of get involved in making changes in Epic to make our workflow easier. So the one specifically that I worked on was um, all of the information related to alcohol withdrawal that's kind of scattered around Epic, putting it into one summary tab that you can easily kind of look through, look at prior admissions and how much benzos or barbiturates somebody needed. So those kinds of things I think were always in the back of my mind as things that made my work easier generally. Fewer clicks, I think, was my goal. And so here, that's kind of been what I've been interested in. And I think what's been a little bit hard over the first 2 years, and it, moving from system to system, we have 4 different sites that we rotate at. 3 out of them use Epic, but Epic is sort of different at every hospital, and it's hard to get started on something and continue doing it when you're moving from site to site. And so I think just this past year, I've kind of had a little more continuity, and it takes some time to realize what the problems are.
Yeah.
But one thing that I was kind of working on over the past year was uh, this is sort of specific to heme, but heme malignancy, but like for bone marrow transplant and for the inpatient heme malignancy service, particularly acute lukes. Um, in the note, we always document what day it is of transplant or what day it is after chemotherapy. And the way that we were doing it before was you would manually change the day every day, and inevitably someone would kind of miss a day or things would get off track, and it was just never accurate. And it's not, I don't know, that's what computers are for, right? To automate something like that.
Yeah.
So I kind of worked with the Epic people here to develop a smart phrase that just kind of automatically either calculated from the transplant date, how many days it's been, or from a manually entered date for if you like started an induction chemo regimen. And it's been somewhat successful in that other people have used it. I think it's been more than just myself using it, which is nice. I guess that's a long-winded answer saying I like working with technology to make things easier for us.
No, I can remember times where I was fatigued and I was like, did I change that number? Yeah, those are the same issues. Those are not just University of Minnesota issues. Those are
Yeah,
issues everywhere because you like to count and you're like, oh, I don't remember if I changed it last time. And then you spend the next 5 minutes trying to go back to what the date was and calculating back, and you're
yeah,
figure out where then the dominoes stopped falling.
yeah, exactly.
And it's just, yeah, it's an
Um,
efficient effort. So,
yeah. So I guess my interest going forward, and third year I have a lot more research time. I just started a research month now. So my interest is really to be on the actual physician builder side of things and make those smart phrases instead of requesting people making things for me. So I signed up for some of the EPIC classes in Wisconsin in the next couple weeks to get kind of the basic stuff down, and then I want to do a little bit more oncology specific, like beacon planning and things like that. And I have some things in mind, but I don't want to necessarily commit to them yet. So I don't want to necessarily say what I'm going to do.
Got it. Well, you're going
Grand
to Epic
ideas, but
headquarters. You're going right to the core.
yeah, yeah. We'll see if it's what I want to do is possible or not. But
Sure. Well,
I'm just kind of in a learning phase right now.
I was going to say that's going to be the right place to go though. They'll be because they know all the kinks and
Yeah,
secret.
yeah,
um, Throughout life, we all have mentors, and they vary, they in different roles and in different aspects of our lives or different time points. So who do you have mentor one or more than one, and that you would, that you look to or have looked to in the past, and how have they helped mold you into who you are?
yeah. That's a good question, and I think the mentors come in a lot of different um, forms, and I think one I kind of mentioned my uncle in New Jersey. Seeing his career and just talking to him about medicine over the years, and with that politics and practice, he's in private practice and the way things are managed. I feel like that's been a big influence on the way that I think about what I want my career to be in medicine. I think in residency, I had a one particular hospitalist that I worked with a couple of times who mentored me in doing some clinical vignettes and research, but I feel like really helped me think about like how to think about myself as a provider eventually instead of a trainee. And he kind of helped me find my first job, and he's the one person I still stay in touch with really from residency. And he just kind of gives me advice from his experience. He's maybe a decade ahead of me in training. And then I guess during fellowship, it's been a little bit different in terms of I feel like there's so many people we work with. Like every week, I'm working with a different clinician, so it's not so much work dependent necessarily. But this kind of sounds weird to say, but my wife being in radiation oncology and being the person I talk to about all of my cases and all the interesting stuff we're seeing, I feel like she's kind of not necessarily mentored, but it's kind of my ongoing relationship in oncology,
Yeah.
kind of helping me figure out what my style is, what I would do in certain scenarios, kind of helping me sometimes grapple with the morality and ethics of things. Um, I would say like it's a unique relationship to have a partner who's kind of in the same field, and it's
Yeah.
been a good and positive thing for me generally.
Yeah. I could imagine that in the same field knows the science, but a little bit oblique, right? So she's coming at it
Yeah,
from a different angle. So it's not just two sort of straightforward oncologists who kind of have
yeah,
always trained under the same sort of umbrella of teaching, but her approach and what she is doing in her practice is potentially somewhat different than yours. And so
yeah,
I think that really offers
yeah.
a more well-rounded approach.
Definitely. And I would have very little insight into what radiation oncology is like without her perspective.
I
So
think I don't.
it's very
I
educational.
certainly don't. I have like a vague
Yeah.
sense, worked with a couple, kind of seen the machines, but that's about it.
Yeah.
Then of
Yeah.
course I'm further from it now than ever. But
Yeah.
so what do you think your career plans look like post fellowship in the short term,
I
maybe even longer, 5, 10 years out?
Yeah, I think I initially, when I was coming in here, anticipated some component of research or other administrative time. And like, I'm fairly certain at this point I'm going to be 100% clinical, because one, patient care, I think, is what drew me to medicine in the first place. It's what I find the most, um, I don't know, rewarding, I guess, meaningful. And I also really just, I feel like that's where I learn the most and the best is by actually kind of the day-to-day grind, which it is a grind sometimes, but that plus working with trainees kind of all ranges is what really is that's what I think my role is in the world. And I think adjunctive to that would be anything I can do in my spare time, kind of in the line of working with Epic or working with other projects that are quality improvement type projects would be sort of on the side in addition to clinical work. And I think at this point, and for the time being at least, I'm going to stay general in terms of practice. I haven't found one thing that I love enough to give up everything else in hemo. So I just really like seeing and doing a little bit of everything. So,
Got it.
although I don't know how long that'll be possible in our field, so we'll see.
It's an evolve. Yeah, all of our subspecialties start to evolve and they start to branch out even further.
Yeah.
It's just kind of the way of the world in some ways. I mean, there are people that are out
Mhm.
there and doing that, but sometimes I think that there's also that sense that you can get so stretched doing that that you don't get to do
Yeah.
as much of what you
Yeah.
really want.
Yeah. And it's fewer and fewer every year. So,
Yeah, exactly. So you were speaking of spare time, although in that case you were speaking of work time, period of time. What about spare time enjoyment in support systems? Right, you talked about your wife being a support system as well,
yeah.
but I'd
Yeah.
love to hear about like what do you like to do for fun? What do you do in that spare time?
So I'll say there was before having a kid, and then there's now. Those are two different distinct
That
time periods in
is
my
very true.
hobbies. We actually had our son during my first year of fellowship, like in September, October, and I think this program was incredible, and it has been for other fellows as well, for kind of the idea of having a family and having a family life and a work life balance. I've found it to be very conducive to that over the last year and a half.
Mhm.
Our 18-month-old son is uh, a handful and is exciting. And right now, it's really just that's all my spare time. That's where it goes. But it's fun, and I'm learning a lot. Outside of that, just how to be a parent is kind of a new field for me. And then before my child was born, and hopefully a couple years down the line, I really was. I grew up as a swimmer. I did a lot of running and biking over the years, and I did some triathlons in the past, and I'd like to get back to that at some point. And my wife and I met skiing. I snowboard. My wife skis. We camped a lot and did a lot of outdoor like backpacking and backcountry trips. And so that's something that we'd like to get to at some point. We'll probably start with car camping when we have little kids, and then get to the point of more, uh, I guess, national park kind of backcountry type trips.
Mhm.
Hopefully in the next few years. But that's one other, I think, big thing that drew us to Minnesota is we met in Colorado. We always had this idea of moving back to the Rocky Mountains, but I think it's unrealistic for us, like in the grand scheme of things, because of a lot of different things. But just the fact that I don't know, are starting to set up a life here, and we love the environment here. But I think in particular, being able to go outdoors and get out of the city and get up to even a couple of ski areas here has been really, really great. That's kind of what we want our kid to be raised around, and that's what our interests are. So I think that's one thing we love about Minnesota as well, as we can continue doing some of those things.
Yeah, I think that I echo a lot of those sentiments. Well, even as someone who's also a pediatrician, uh, being a parent was very different than learning about being a parent.
Yeah.
And then what I thought worked what worked for our first son didn't work for our second. So there's a relearning process that will happen if there's other children down the road. But to your point
Yeah.
about outdoorsy stuff, you can go not really that far outside of west. Certainly I live on the west side of town, but
Mhm.
there's camping out there and such. But you can go up to the North Shore, and
Yeah.
we weren't much campers beforehand, but we'll have our car and we'll find one of the we'll park and we'll camp for 3 days, and
Yeah.
it's beautiful, and the scenery, and then like you said, you can get up to Lutsen and get some more legitimate skiing.
Yeah.
uh, but I
Yeah.
will
No,
say
it's great.
places like Afton are good for teaching kids.
Yeah. Yeah. That's our
um,
goal, is in the next year, I think, to get him out there at least once or twice.
yeah, so kind of getting towards the end here, but if you weren't a physician, what would you be?
Well, uh, I always joke about this with my wife that I would probably just be a ski lift operator somewhere. I think realistically, I would probably be in some sort of field adjacent to medicine, because I think I just couldn't see myself working in an office environment. I think it would have to be something where you're interacting with people and you're not doing a ton of paperwork or working on a computer, which medicine is a lot of computer based work.
I was going to
But
say
I
your
don't know.
career is driving you towards computer-based work, but
Yeah. Yeah. I guess it would be like ski patrol or something like that.
nice.
Yeah.
And then the one I like to ask probably the most is if you were pretend you're a travel agent, so where should I travel and why? Where would be one place that you'd tell me to go?
Um, I I've done a little bit of international travel, but I've always kind of loved exploring different parts of the country because it's so much more accessible.
Mhm.
And I feel like you can kind of get lost in some places here, which is sometimes hard to do in like more city-based environments. And so I really think exploring the like Rockies and going north past Colorado or like Grand Tetons or even south, like in southern Utah, there's a couple of great national parks. I guess the one I'm going to recommend here is Black Canyon National Park. Was one of my favorite places to go because it's just so remote. There's nobody around. You can kind of hike down the canyon and spend the night there, and it's pitch black. It's just you and the stars and a river next to you. I mean, that's like I think the best place to me to be is somewhere out in the Rocky Mountain area for like a week at a time and just forget that anything else exists in the world.
Is that and then that's Black Canyon of the Gunnison, is that right?
Yeah,
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 okay. I've seen pictures of it and I've seen how dark and how deep it is. It's super deep.
yeah, yeah. It's about
Never been there
a
because that's Western Colorado. Is that right?
it is, yeah. What's like southwestern, yeah.
Yeah, because we did a couple of years ago. We did Moab, and Moab was great
Yeah,
because you could do two state park, or you could do one state park and two national parks within like a couple, within
yeah,
30-45 minute drive. And they're so
yeah,
different, Arches and Canyonlands are so different. So
yeah,
I echo
yeah,
the sentiment now that we've been doing that a little bit more, getting out in nature and exploring the national parks. I have a
yeah,
national
yeah.
park
And
map back here that we mark off when we get to go.
everywhere you're going in Minnesota, nice,
Yeah.
nice. That's cool. We got to make it up to Boundary Waters at some point. We haven't yet, but hopefully next summer. I don't know if our kid is old enough yet.
Yeah. Probably
Yeah,
maybe a little bit older, but close, close. So
yeah, yeah,
anyways, well, thank you, Miheer. Thanks for sharing your experience. And it's been a pleasure working with you when I have on different rotations. And so best of luck as you kind of and finish up the second year and go into third.
Thank you, and thank you for doing this. I appreciate it.
Yeah. All right. Have a good rest of the day. See ya.
You too.